Yes. Okay. Good afternoon all. My paper is on the effect of MYDRIATIC, that is TROPICAMIDE and PHENYLEPHRINE on OCT angiography parameters in diabetics and controls. Introduction. An OCT angiogram is usually done on a patient in mydriatic state, and the drug commonly used to dilate the pupil is 0.8% tropicamide and 5% phenylephrine. Tropicamide is a benzene acetamide which is a parasympatholytic agent which blocks the M4 muscarinic acetylcholine receptor. Phenylephrine is an alpha-1 adrenergic receptor agonist that induces vasoconstrictive activity. Both these drugs were found to have an effect on retinal capillary perfusion. A drug-induced change in the vascular status of the macula has not been established unequivocally. Aims and objectives. The pre- and post-mydriatic foveal avascular zone area, vessel density and perfusion of the macula was compared between three groups of patients. First one, normal subjects. Second one, diabetics without retinopathy. And 3, diabetics with retinopathy. 16 normal subjects were included in the study. 37 patients without diabetic retinopathy and 8 patients with retinopathy. Materials and methods. Inclusion criteria included all patients who visited ophthalmology OPD and were willing for dilated fundus examination and an OCT angiography. Exclusion criteria included center involving macular edema, history of glaucoma, history of VR surgery, refractive error more than 6 diopter, any condition impairing the media clarity which prevents good quality OCT imaging like opacities, corneal opacities, uveitis, dense cataract, vitreous hemorrhage, and non-diabetic macular pathology. This is a cross-sectional observational study. A total of 61 eyes were enrolled, out of which 45 eyes were of diabetic patients, of which 37 had no diabetic retinopathy and 8 had diabetic retinopathy, and 16 eyes were of healthy controls. After standard ophthalmic examination, OCT angiography 3x3 was taken before and after dilatation using HD Cyrus OCT 500/5000. The parameters compared were the foveal avascular zone area and vessel density and perfusion of the center, inner and full areas. Moving on to statistical analysis, the software used was SPSS MAC version 22.0. Changes in the FAZ vessel density perfusion were tested using paired t-test. Stratified analysis was done for those with and without diabetes. The diabetics were further stratified as those with and without retinopathy. Statistical significance was defined as p-value less than 0.05. Moving on to results. 35 eyes of females were included in the study and 26 male eyes, and there were 34 right eyes and 27 left eyes, and the diabetic status 37, that is 82% had no diabetic retinopathy. 3 eyes had mild NPDR, 4 eyes with moderate NPDR, 1 eye with severe NPDR, and no eyes were included with PDR. Moving on to vessel density. So among the 3 groups, before and after dilatation, a statistically significant increase in vessel density was noticed in the last group, that is in diabetics with retinopathy. Similar results were also seen in vessel perfusion, where a statistically significant increase after dilatation were observed in diabetes with retinopathy in the center and full area. In foveal avascular zone also, an increase in foveal avascular zone area was noted in diabetes with retinopathy after dilatation. But here in FAZ area, the value was not statistically significant. Moving on to discussion, a statistically significant increase in vessel density and perfusion after administering the drug were noticed in the macular vasculature of eyes with diabetic retinopathy. Significant interruption of blood retinal barrier, excess in diabetes at the vascular endothelium. This can increase the intraretinal concentration of the mydriatic that is applied. Tropicamide is a drug that has maximum transport across the cornea. It can theoretically abort acetylcholine activity in pericytes. Thus, it can limit the contracting ability of pericytes and keep the vascular wall relatively dilated. And phenylephrine acts mainly on the alpha-1 receptors, and capillaries of the macula has got alpha-2 receptors. Therefore, phenylephrine cannot exert activity at the macula. And in the study, along the preservative in the mydriatic was chlorbutal, and it is known to have it is known to weaken the contractile response of the vascular smooth muscle. This could also be an added factor in increasing the perfusion of macular vessels with defective blood retinal barrier as noted earlier. Then, as the principle of OCT is based on broadband light source, flicker-induced over-response in the anatomically and functionally compromised retinal vessels also may be considered. Conclusive note, OCT and OCT angiography are commonly employed standard investigative procedures in diabetics and retinal clinics. On the basis of our findings, we would suggest that these tests are preferably done undilated if at all possible for a better delineation of macular vasculature if an underlying pathology is present. Thank you.
Thank you.